Okay, thank you very much. So this talk is going to be on characteristics of basal cell carcinoma subtypes, long pulse 1064 Nd:YAG treatment with OCT, optical coherence tomography guidance. So BCC is a common skin cancer typically treated by surgery, and long pulse 1064 Nd:YAG is a non-surgical treatment alternative with potential for decreased morbidity. And OCT could be used for tumor depth, for mapping tumor depth and margins. So for our methods, this is an IRB approved prospective study where we use long pulse 1064 Nd:YAG laser, and we used OCT for pre-treatment tumor mapping and monitoring of outcomes, and adults with biopsy proven superficial nodular BCC were included, and BCC on the trunks and the arms were included. Exclusion criteria were BCCs greater than 2.5 centimeters, BCCs on the head and legs, and high-risk histologic subtypes, and local 1% lidocaine was injected before treatment. So there were two treatment types: the conventional with a higher energy fluence, 120 to 140 joules per centimeter squared, with non-overlapping pulses, 1 to 3 passes, and CHAMP controlled hyperthermia and monitored protocol with lower fluences, average temperature of 55 degrees for 60 seconds, and the BCCs were scanned by OCT at 3 to 12 months for signs of persistence with a maximum of 3 treatments. Excisional surgery was done at the end of the treatment period, and statistical analysis was done. These are our results: 34 lesions in 27 subjects, 63% were male, 37% female, and 44% were in CHAMP, 56 in conventional. Of the BCC subtypes, 16 were superficial, 11 superficial and nodular, 4 superficial and pigmented, 2 nodular, 1 pigmented, superficial, and nodular. And so we found that 85% of the BCCs were clear on excision, while 5 out of 34 were positive. And of those that were clear, 16 received 1 treatment, 8 received 2 treatments, 5 received 3 treatments. And of those found to be positive, 4 received 4 were treated once, and 1 was treated twice. And for the initial average OCT depth of the cleared BCCs, average depth of 398 micrometers, and for the positive BCCs, average depth of 364 micrometers, and not statistically significant. And in the 29 out of 34 clear tumors, 13 were treated by CHAMP, 16 by conventional, and in the 5 out of 34 positive tumors, 2 were treated by CHAMP, 3 by conventional. And of the clear BCCs, 14 were superficial, 9 were superficial and nodular, 3 were superficial pigmented, 2 were nodular, and 1 was pigmented, superficial and nodular, whereas for the 5 positive BCCs, 2 were superficial, 2 were superficial nodular, and 1 was superficial pigmented. So in conclusion, 85% demonstrated to be clear of tumor by excision at 3 months or greater. There was no specific pattern between subtype of BCC and clearance of BCC, though there was a non-significant tendency for more superficial BCCs to be somewhat resistant to treatment. And so these results show long pulse 1064 can successfully treat varying subtypes of BCCs at diverse depths. The limitation of this study is the small sample size and limited assessment of other subtypes of BCCs. And given these promising outcomes in the future, we plan to alter the treatment, probably lowering the target temperature and extending the duration of constant hyperthermia. And I would like to thank Dr. Zachary, Dr. Kelly, and everybody from UCI. Thank you.